Hello, everybody. Well, we have a fascinating topic also as a result of many questions in the other episodes and season 1. Many people is asking, how do I protect my teeth at night? And that is an extremely important question. And why is important? Because if you think about what can happen to your teeth if you're not protecting at night, there are several things that we talk about it. If you remember on the chapter of how important was the fluorapatite and the brushing and flossing, how to avoid decay, how to avoid a root canal, everything is related one to another. We're separated little by little, so you can understand better the fascinating world of our mouth. If you have the whole day we're talking, our saliva is moving, the salivary glands are producing saliva, the night comes, we go to rest, some of us sleep with the mouth open, and guess what happens? Usually the mouth gets drier when we're sleeping. Why? Because the salivary glands are not moving, they don't need the function to do, so they're resting, just like us. And when we sleep, and it's worse if we snore, because you snore and your mouth gets even drier, you don't oxygenate well. We're gonna talk about that in the next topic about bruxism, which is why do I grind my teeth, what do I do? That you're gonna love that one. But the important part of this episode is to know, how do you protect the teeth? Protecting from what? Protecting from having cavities. If you have a high risk of having caries everywhere in your mouth, and you say, well, you know, my dad was like that, my mom was like that, they lost the tooth. We didn't have too much advancement maybe at the time of your parents, or maybe if they didn't have access to a good dentist, or somebody that really knew how to avoid a problem, or simply the patient wasn't compliant. It wasn't following the instructions of the dentist. Without knowing that at night, the saliva in the morning can remineralize the enamel if you have a clean mouth, because saliva acts like a buffer. It's gonna contrast the acidity, and it's gonna neutralize depending on what the saliva needs to do. However, at night, when we're resting and the mouth becomes dry, you have to use something to induce saliva formation. One is Biothin. It's a spray they sell on the pharmacy. They have also like CVS brand, or that we saw in episode 1, or in Rite Aid, or any of the pharmacies that we have in the United States, Walgreens, etc. And you look at the products, they have chewing gums, they have xylitol, also gums that avoid having decay. Xylitol is an amazing molecule that avoid having caries. So you're gonna protect against all of that. And also, you're gonna protect even worse to have cracks. So I lecture around the world, and one of my lectures that has been extremely important for general dentists and our colleagues is cracked tooth syndrome. When you have a crack in a tooth, you have to check how much grinding are you doing, and we're gonna talk about that in the next episode. They're very connected, but they are different, and I don't want to bother you. So you're gonna look at night, you're clenching or grinding. I'm gonna show you how do you know, but the best of all this is that the protection that we need now not only is gonna be with the night guard, that later I show you an image of a night guard, but in this situation, you're gonna have cracks in the tooth. This is a small crack. If you are grinding or you're chewing something that is not good, and at night, if you have a tiny little fissure, like you see in this model that we were talking about in many chapters, many episodes, and you have this little line, and you sit in your front tooth, but almost nobody see it, but you grab a magnifying glass and you see it, or your dentist say, hey, you have a crack, or you have a crack on the side of the tooth, like in this part, this tooth is being prepared for a crown. Then you see that your teeth are becoming, look at this, a little bit flat in this area where you're very young. I've seen kids of 16, 17, 15. Now our world is more stressful for the kids, and becoming adults, you know, when they get to 20, 21, I see they're destroying their teeth. And it's just because they haven't taken a look what are they doing at night. So they have to protect with a night guard that we're gonna talk later. But also you're gonna have to see, in this case, I will show you that you don't wanna go to the extreme of this. This is an extreme situation, and this is, Dr. Vijay allowed me to have this case of a patient that we will talk later about cases, but in this presentation, what I did was to talk about the cracked tooth syndrome. And in the cracked tooth syndrome, I have to talk about grinding, because grinding is an amazing problem in America, well, in every part of the world. I don't think anybody has seen in a country that you don't see this type of destroy of the teeth. And these patients can be very young and they can be very old. Now, this reconstruction is extremely expensive, especially because you want the best. And Dr. Vijay is a prosthodontist, and you have to, in your country, you have to look anyone that either is specialized, that went to a 2-3 year specialty in prosthodontics with prosthetic dentistry, because they will analyze the way you bite. And if you lose a tooth, they will know exactly where the implant goes, depending on the support that you have on the posterior area. It's not only the way you look, it's the way you're gonna be able to eat, and the way you're gonna be able to sleep, and the way you're gonna protect your teeth at night. There's another situation that you have if you have a case where you are producing so much decay. The dentist can prepare a tray for you. When we talk in the chapter of whitening, either the whitening trays can be used similar because they're soft, or if you have your night guard, that we talk about that, we will talk also in the next chapter about Brooks's grinding your teeth and what do you do with this. You will see the trays that we have that are made in our office by Dr. Vijay, and in the dental office also they send to the lab, and they're gonna protect your mouth very well. I'm gonna place an image here that we're gonna see in several of the episodes. But in this situation, this is a very sad, this molar is very important. When I open the tooth and I look at the microscope, then the tooth has to be extracted. So you're not protected only against, the caries that you have to use, that the toothpaste, remember, we say you have to use fluoride. They usually have calcium phosphate, and calcium phosphate is gonna help you to remineralize the enamel that maybe the bacteria was trying to destroy. Then right there with your toothpaste that has calcium phosphate, take a look at the formula, and has fluoride, is gonna protect you. Fluoride is gonna make it stronger, and calcium phosphate is gonna reduce the remineralization of the enamel. And also, let's say you're a patient that has too much decay, then you're gonna sleep with a tray with fluoride. And there's so much that we know now at molecular level, genetic level, that we can even prevent, not only with the brushing and flossing, but also in the way you eat. We talk about diet, in the way you chew. What you chew is strong. What you're gonna do when you have an apple, cut it in pieces. So you protect the teeth all day, but at night specifically, if you're a grinder, if you have your mouth dry, the mouth is gonna get drier, remember that, at night. So what do? You protect it if you're grinding your teeth with an eye guard, or you ask your dentist to give you trays to have fluoride treatment. There's no harm on that, and nothing is gonna happen because your teeth are mature. The only thing they're gonna do is protect it. And that's exactly what the topic is. That's exactly what the people was asking us for. Imagine if you don't protect the teeth at night, and you choose something hard, or your tooth fracture, and it ended up fracturing after you have a root canal, and we have to do the extraction of the tooth. And it's very dramatic because it's a front tooth, and you're gonna lose it, and there's nothing. Take a look at the cracks that this patient have. He had a root canal, he had a crown, and now, how do you avoid this? How do you protect it? So you protect it, remember, for decay because of salivary, the nutrition, the bacteria. So what you're gonna do from now on, my dear, in the next episode, stay put and don't lose the episode, because we're gonna talk about if you're grinding and clenching, and how do you wanna avoid these type of cracks like this, losing the tooth, spending a lot of money, or spending money in a full mouth reconstruction as the patient that we saw is gonna be okay. We're going to talk about what happens if you don't use a night guard and you spend hundreds of thousands of dollars in a full mouth reconstruction and you did not have a night guard after that. You're going to start losing your restorations by the grinding. Thank you. And come to my channel, subscribe, make your comments in the channel, press the like button, and follow us on Instagram and TikTok. Thank you.